Thank you.
The President of African Mothers Initiative. I am here in the capacity of all the mothers that are going through pain and anguish because of their children who are passing through addiction. I want to thank NDLEA for their jobs. They've been doing very well, extremely well. We appreciate them. But yet, the growing spate of drug abuse is tormenting the mothers. Creating another agency, another department is needed at such a time as this. Therefore, I want to thank the chairman of this committee. I want to thank the person who has proposed this bill. And I want to thank you for not just considering the financial status quo of Nigeria for now, but considering the people of Nigeria. The people make the country. And when the people are established, we make the resources. Our youths are crying. The pain is enormous. The hospitals are even, in fact, it's overoccupied. The psychiatric homes. The Ministry of Education was supposed to be here. But I know they have a lot on their table. We are still crying about the JAM result that was recently posted. Why would we ask them to do more when they have a lot on their hands already? If establishing this agency will be an addition to what NDLEA is doing, why then should we oppose it? Is it because of duplications of duty or our scarce resources? Let us as mothers, we have mothers here, let us first consider the humans of Nigeria who will bring more access to more funding and more resources and rebuilding our society. As the President of African Mothers Initiative, I want to support this bill and I want to appreciate whoever brought in this idea because this is one of the things that we need now and we need even later. The youths are increasing in their numbers and the abuse is also increasing. I wanted to also talk to the Ministry of Education because somebody talked about forming a club, an organization in schools. We have jet clubs in schools, we have debate clubs in schools. NIDA will be able to handle drug abuse clubs in school. NDLEA are doing so much in enforcement.
You should be
We need more. Thank you so much, sir. Thank you.
Okay, thank you. I think the African fathers too are very Substance abuse is undeniable. It fuels crime, exacerbates mental health crisis, strains our health care system, and more strategically, claim precious lives, leaving behind a trail of broken families and shattered dreams. We as a nation have a moral imperative to confront this menace head-on, and it is precisely this important National Institute for Drug Awareness and Rehabilitation is not merely another government agency. It is envisaged as a beacon of hope, a center of excellence dedicated to multifaceted approach to drug control. We will seek to establish an institution that will save.
Angle touching the mother who knows the impact and negative effect of drug abuse on our people. Can you say in summary your presentation, summary form?
Okay, thank you very much. You see, my presentation is not too much on the side of the funding or the resources. I know it is very relevant for us to take cognizance of the fact that we are trying to rebuild our economy. The renewed hope agenda of President Bola Ahmed Tinubu's administration is working seriously to rebuild our economy. And therefore, some might think that it is not the right timing to bring up another agency, department, or ministry. But due to the trouble and the aspect of drug abuse, the increasing number of drug addicts in our society, it will be a negative impact on our government and on us as humans to ignore this bill. This bill is very important at such a time as this. Our kids in schools are suffering. The youths are going through a lot. The mothers are in pain. I represent African Mothers Initiative, and I'm talking from the perspectives of mothers who are going through these pains and these challenges today. And therefore, I would strongly still recommend, from my conversation inside, my speech inside, I still stand by it, that this bill is a welcome idea. And the establishment of the National Institution for Drug Awareness and Rehabilitation should be highly welcomed. It should also come in tandem with the renewed hope agenda of the President Bola Ahmed Tinubu administration.
You will be surprised to hear that the NDLEA is against it. How do you say that?
And see, well, we are all humans. When we had civil defense trying to come in, we had opposition from the police. When we also had the Peace Corps trying to come in, we had opposition from the civil defense. So this human factor always rises up when things like this come in. But if we want to grow as society and consider the human capital and build as this is the core of the society, the well-being and health of the people of the society is the core of the society, the fundamental of the society. We should ignore all
How do you see this as duplication of duties?
Yes. If you're calling it duplication of duties, it means that you want to say that there was a lagging behind, a great lapse in NDLEA. I wouldn't want to see it that way. I want to see it as another angle, assisting NDLEA to do even better.
Thank you so much.
Margaret Mpanam, African Mothers Initiative.
Margaret Mpanam.
Mpanam.
Okay, thank you.
Thank you, sir. Thank you very much.